Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today, the topic is thrombosis and palpitation link exposed. Ordinarily, you want to think of palpitations in terms of only heart problems. But those things that really predisposes to heart problem, that makes the heart goes beating, that you can hear the sound of the heartbeats, are many, and we could think of inflammation and infection apart from other reasons that I have discovered as dehydration and even heart problem itself. But there is also this deep vein thrombosis, which can then lead to that pulmonary embolism, blocking of the lungs, which will eventually may cause palpitation or even if care is not taken. Sorry. So my effort today is trying to look at that link between the deep vein thrombosis and palpitation, and we can understand more when I handle such topics. But if you like the way I handle these topics, press the subscribe button, press the like button. Many friends have asked me that, oh, you are making so much from you. No, nothing, because subscription has to reach a certain level, at least 1,000, before you can start getting monetized. So right on pressing this subscribe button if you are really enjoying this video of mine. Let us now define some terms that I am going to use. Very necessary for you to understand these terms. If you don't understand the terms, you get confused. I've heard many of my viewers complain that when I start using those big terms, they are lost, but they enjoy it. Nevertheless, let's understand the terms. When we talk about terms, we are talking about definitions. Definitions of the terms like thrombosis. Thrombosis is a blood clot in a part of the circulatory system. When you talk of the circulatory system, you are talking where the blood flows through from the leg up to the brain to the heart, but the heart pumps all the blood around. And inside this blood, there are what we call thrombocyte. The thrombocyte is another word for platelets, and they usually perform miraculous work of making sure that there is no leakage. That is, the blood does not leak outside. Once it leaks outside, it quickly blocks it by coming together closely and forming a clot. Then there is the deep vein thrombosis. That is when the big vein in the leg has a clot. And sometimes these clots will now break away and move straight to the heart, and oxygenation and into the lungs as well. That will cause that problem we are calling palpitation, because it will block the hair. It will also block the blood from flowing. So palpitation is that noticeable increased pounding sound of the heart that is experienced. Pulmonary embolism is a condition when one or more arteries in the lung or the lungs become blocked by a blood clot. We've known the terms. Now let's try to look of any link between thrombosis and palpitation or heart problem. When we are able to get that link, then we can now go on into the diagnosis. This photo really shows clearly the linkage of thrombosis and palpitation, because you can see from the picture, once there is a clot from that, a breakaway from the thrombus, that blood clot, the embolus will now move towards the heart, and then it can block the heart too, that blockage will surely cause that serious problem of coughing or even coughing blood as well as palpitation. And then when it moves towards the lungs too, that clot could also block the right and left pulmonary arteries as well, and you can also have that blockage, that shortage of breath. So when there is a shortage of breath, the heart will agitate as usual because everything is now under stress, and that palpitation is expressed. So we can, from this diagram, even connect the link, and that is there is a very large studies that confirms this linkage by many scholars. Having proven the linkage, there are people who are at higher risk of a blood clot. These are people who have inherited condition or have genetic problems. Abnormal blood vessels too, such as varicose vein. You find varicose vein so conspicuous in many people, in some people rather. Certain diseases such as cancer or heart disease could also prone them to this blood clot. Pregnancy or in the 6th week following delivery. Then smoking is another tough one. Obesity will also be the cause of blood clot because they more or less sit down for too long, sedentary life. Long cars or airplane rides without stop to get up and move around. That's another one. Prolonged bed rest after major surgery or trauma. Oral contraceptive pills, hormonal, older age, 70 years and above, people with prior history of blood clot, especially once there is a trauma. Like I mentioned, platelet will always want to block blood from coming out. So in the process, there could be blood clot. The more screen faster a person has, the greater the chance of having a blood clot. The diagnosis is very simple. The blood test, you use this dimer test. The CT scan, the dye is used to locate the clot, and the echocardiography too is also useful. When you do D-dimer test, the normal range is when it's less than 500 nanogram per mil, then no serious blood clot. But once it's elevated beyond 500 nanogram per mil, there is an active blood clot. So then you probably can go. Finally, my profession is medical laboratory science. So you can know from that I don't so much talk about treatment. But regardless, you can always have idea of the treatment because some treatment are off the shelf. Some treatment are, you can always get them on the shelf. That is, you can purchase them from the pharmacy easily without any prescription. So I want to say treatment of deep varicose vein has to do more with finding blood thinners, and blood thinners could be medications, that is chemical compositions, or natural ones. The naturals are citrus fruits, those containing vitamin C, mainly antioxidants and co.